Let us now consider some of the bones of the leg and foot and also their articulations of the tibiofibular joint. So the bones of the lower leg are the two long bones, the tibia and the fibula. The tibia is the main weight-bearing component of the lower leg, and the fibula has a relatively non-weight-bearing role. Its main role, in fact, is to increase surface area for muscle attachment. Looking briefly at the bones of those two bones, the tib and the fib, the tibia has several prominent features such as the tuberosities, the medial and lateral condyles, and there is an anterior border supplying which leads onto a medial surface, and inferiorly it leads down onto the medial malleolus. And then posteriorly, on the posterior side of the tibia, we have the soleal line for the attachment of soleus, and also the interosseous border becomes visible and the main shaft of the tibia is apparent. For the fibula, the main features of the fibula are the head of the fibula superiorly and the anterior border and the interosseous border, which links the interosseous membrane between the fibula and tibia. There are various crests and surfaces also on the fibula which lead down into the lateral malleolus. Let us now consider some of the articulations in this area between the tibia and the fibula. There are three to consider. The most superior of these is the superior tibiofibular joint. It's classified as a synovial plane joint. The articular surfaces occur between the round facet on the head of the fibula with a similar congruent facet on the condyle of the tibia. They're both lined with hyaline cartilage and have a capsule with lining of synovial membrane, features that are familiar in any synovial joint. It is also reinforced anteriorly and posteriorly by the tibiofibular ligaments. The movements available at this articulation are merely accessory movements of anterior and posterior glides. Secondly, let us consider the interosseous membrane. The interosseous membrane is a collagenous membrane which passes from the interosseous border on the tibia to the interosseous border on the fibula. It becomes continuous with the interosseous ligament in the inferior tib-fib joint, which we will consider in a moment. As you can see from the diagram, the fibres pass downwards or inferiorly and laterally. What is the function of this interosseous membrane? Well, it allows increase in surface area for the attachment of muscles. It will also compartmentalise the anterior and the posterior muscles. It allows movement of the fibula and also will provide a certain amount of stability as well. And because along its length there are various holes for the passage of vessels from anterior to posterior or posterior to anterior. Finally, let us consider the inferior tibiofibular joint. This joint is classified as a syndesmosis joint between the triangular roughened facet on the lower end of the fibula and a corresponding facet on the tibia. The joint space is it's not like a synovial joint where there's a capsule and membrane, but the space is filled with an interosseous ligament, which we have mentioned previously links in with the interosseous membrane. It's reinforced anteriorly and posteriorly by a transverse tibiofibular ligament.